Ballon tamponade, or UBT, is used when the uterus does not contract after the birth of the baby and the placenta. The bleeding becomes severe. This is a life-threatening emergency on postpartum hemorrhage. A uterine balloon tamponade can be used as definite treatment of postpartum hemorrhage. Ballon tamponade can be inserted by midwives, nurses, and physicians and is easily assembled with affordable materials. It is important that skilled birth attendants when and how to insert ballon tamponade. A kit should be readily available such that it can be assembled quickly and easily. The equipments needed: catheter, condom string or suture, sterile water, a syringe and basin, gloves, sponge, forceps and speculum, and a light source. Once the decision has been made to insert the balloon tamponade, hands should be washed with soap and water or sanitizer. Gloves put on and the balloon assembled. The condom must be removed from its wrapper and unroll the Foley catheter. Is then inserted into the condom and tied on with string or suture materials. Ballon tamponade can be inserted by midwives, nurses, and physicians and is easily assembled with affordable materials. It is important that skilled birth attendants knows when and how to insert the balloon tamponade. A kit should be readily available such that it can be assembled quickly and easily. The equipment needed for UBT insertion are the following: catheter, condoms, string or suture material, sterile water, a syringe and basin, gloves, sponge, forceps, a speculum, and a light source. Once a decision has been made to insert the ballon tamponade, hands should be washed with soap and water or sanitizer. Gloves put on and the balloon assembled. The condom must be removed from its wrapper and unroll the Foley catheter. It is then inserted into the condom and tied on with string or suture material. Once secured, it should be inserted into the uterus. This can be done by feel or with the help of a speculum and light source. Once placed in the vagina, the Foley bulb is inflated with 50 millimeters of clean or sterile water. This helps to keep the device in place using the second port. The condom is then filled with sterile water by drawing water into the syringe and injecting it into the second port. Approximately 500 millimeters of fluid can be placed in the condom. The condom must be inflated enough to apply pressure to bleeding vessels in the uterus, resulting in reduced blood loss. Once inflated, a pack can be placed in the vagina to keep the Foley in the uterus. The balloon is left in place for up to 24 hours and then gradually deflated. One dose of prophylactic antibiotics may be administered after insertion of the balloon. The patient must be checked regularly. Lives can be saved by recognizing that bleeding is excessive after delivery. Administering appropriate medication and using this simple device to reduce blood loss with skilled management of postpartum hemorrhage, we can reduce maternal mortality. If the bleeding continue or the bleeding doesn't stop, replace the balloon with clean water and refer the patient to the nearest hospital. But if the bleeding stops, deflate the balloon and remove the balloon from the uterus. So this is my return demonstration for uterine atony using Ballon tamponade. So remove the glove, wash your hands, document, and report. Once again, my name is Annalise Routine, Bachelor of Science in Nursing, FENMA University of Iloilo. Thank you and have a nice day.